Hi, my name is Marie Pampanin, and I am your host of Yoga Therapy, the Alchemy of Healing. If you enjoy the subject matter or know somebody that might, please pass on our links as well as hitting the like and or subscribe button. Maybe even show us a little bit of extra love and do both. Thank you so much.
Hi, Tina.
Hi, Marie. Nice to see you.
Hey, it's nice to see you as well. So thank you. Tina's coming to have a discussion with us today about cancer. So she's a certified yoga therapist, and her last name is Paul. So Tina Paul.
Thanks so
Did I
much
get
for
that all in
having
there?
me. Yeah, two
So,
first names.
so very natural, just, relax. We're just going to have a conversation about yoga therapy and what yoga therapy is. Mainly because I did hear, from a lot of people, well, what is yoga therapy? And so, really wanting to help introduce yoga therapy to people who may not know too much about it, and more importantly, what people's focuses are, where they can be found, and anything else that kind of comes up in the conversation. So, thank you again for letting me do this interview. I really, really am so happy to have you.
Thanks so much for
Okay,
having me.
thanks. So, one of the questions that I do ask everybody, just kind of from the get-go, is what was your journey to becoming a yoga therapist and why?
That's a great question. For me, it was pretty serendipitous. I was, culturally brought up with the practice of yoga philosophy, kind of in the background, culturally at my home with my family. But I didn't really get into yoga practice until I was in college when I took a class, just for my own personal stress relief.
Hmm.
And then I guess it went off from there. I just kind of got addicted to it and started taking more and more and more classes. And it just was supporting me in, stress relief, working a day
Yeah,
job, living in the city, and just doing the practice to support my own well-being. And then I learned about a program and I got some teacher training, not thinking I'd ever go into teaching or anything like that. And that went on to other trainings, and I did end up teaching just at local studios in my community and the local Y and places. And then I learned about the program at Maryland University of Integrative Health.
hmm
And I was so excited to hear about it because I thought only those types of programs or deeper learning would be, I'd have to go to India.
yeah,
And so I was excited that it was in Maryland. And so I enrolled in that program. Again, not knowing what was going to happen post graduation. I was always working a traditional day job and, you know, doing yoga on the side just for my own well-being and just as almost like a passion. And I enrolled in the program, completed the program, and then did end up working in this emerging field of yoga therapy. So I began working at Memorial Sloan Kettering Cancer Center and joined them as part of a pilot research study they were doing to see
mm,
if yoga can benefit folks that are undergoing treatment or have gone through treatment and are experiencing neuropathy pain from chemo
hmm.
treatments. And so that was kind of where it began and has evolved from there.
Wow. So you now also work at Maryland University of Health, which has a different acronym now, the Notre Dame.
Yes, yes, at
I'll let you go with that
NDMU.
acronym because I'm yeah.
No, you got it. Yes, been also adjuncting at Maryland University of Integrative Health as part of their yoga therapy and Ayurveda department.
Nice. Awesome. So, one of the things that I thought we could explore was the piece of cancer and what you're doing in that research area. And and how that benefits people and what it is that you guys are finding, and how
Yeah,
important research is.
definitely. We did a pilot study, and
Mhm.
I had joined the pilot study at the end of 2017. And that was I believe, of 42 participants. And there were some positive results that came from that. And so the private investigator on that research study received a grant to do a bigger study, a randomized control study, um, and to see if the protocol, you know, will help folks in a larger um, pool of participants. And so we're currently undergoing that randomized control study at the moment. And so
Wow.
that's both at Memorial Sloan Kettering as well as Dana-Farber at
Okay.
Harvard.
So with this study, are you allowed to share kind of what the protocol is?
I unfortunately can't go into the details of
Okay.
the protocol, but folks can read about the pilot study. It
Okay.
includes postures, pranayama, breath work, mindfulness practices. And so it is an integration of different components of yoga and yoga therapy.
Nice. That's awesome. So is it it's definitely built around some yoga therapy, is
Yes,
what I'm
it is.
hearing. Okay.
Yes, it's always been done in small groups.
Hmm.
It's like small groups of participants. For the pilot, it was in person, and now post-pandemic, the study is actually fully virtual.
Oh, wow. Okay.
Yeah, yeah.
Yeah.
So that's been a change. But to meet the times, we had to take
Yeah.
the study virtual. Yeah.
Okay. Well, that I have like mixed feelings about, working with people virtually, but one of the amazing things that I've found is that we have such a wider range of being able to work with people because we now have this platform that reaches beyond our neighborhood, our community. You're in New York and I can have you on and
Yeah, California and
right,
connect. I was just,
exactly.
it's like the Jetsons. I was just talking to my friend about that.
It
It's
kind of does
here.
feel like that, doesn't it? Yeah, yeah. We have a lot going on. Okay. So that's an NIH funded yoga random
Research
controlled,
study. Mhm.
right? And if people were to look up, say, the pilot study, how would they look that up?
They could go to PubMed and put
Okay.
in yoga for CIPN, and it will
Okay.
show up there. They can reach out to
Okay.
me and I can totally send them the link as well. We could post
Okay.
it even in the comments or in the info section.
Yeah, no, that would be awesome. That'd be great. I know that there will probably be some people out there that do want to maybe do some research on their own, because if you don't know what yoga therapy is or, how it can benefit if you are, say, experiencing neuropathy and cancer, I mean, those are two pretty big things. Being able to find some evidence-based components to help with that, I think would be really important. So I love that you're doing this research, and I'm hoping that after, everything gets public and out there, I can come back and be like, Tina,
Yeah,
tell me how
definitely.
it
It is exciting to see more growth in yoga research in general.
went. Yeah, yeah. So just coming back from Kripalu, and seeing the
Yeah,
amount of research that's out there is really awesome, because it shows, I think now more we get to see the difference between just yoga versus yoga therapy, the components of yoga therapy and why they're helpful and why they work together. Um, just from, being in the field of working with people in a therapeutic fashion. Could you maybe share with us some of the things that you find to be beneficial for people that are going through cancer?
Yeah, definitely. What I find that, it's interesting, specifically for this study, I see not just, feedback on, because we're studying to see if it supports pain.
Hmm.
Um, but you start to see a ripple effect, of course, right, on other
Yeah.
things of lifestyle and sleep, um, body awareness, embodiment, stress relief. And so that's what's so, I think, exciting about sharing the practice, and just with anyone, of course, but just seeing the
Hmm.
ripple effects of it throughout, for maybe more than obviously what they walked in the door, coming,
Right.
whether maybe their specific goal, and it moves beyond that. And
Hmm.
so what's exciting is that we'll work with people that have never may have practiced, or that have very little practice, or um, have been afraid to practice. And,
Hmm.
within weeks, you see so much transformation. And yeah, so that's been, I think,
Yeah.
the most exciting thing of working in therapeutic spaces.
I have been amazed in terms of how we can support people in these different areas and watch the ripple effect, of working with the different practices of mindfulness and breath and the postures, as you pointed out, right? So working with that energetic body, working with the physical body, working, with the Manamaya, the mind, right?
Yeah.
And all those words that some people don't have a clue as to what we're talking about, but in layman terms, these are some of the aspects that we're working with. What is the one piece that you might, if you were just to meet somebody off the street, and just be like, oh, this is yoga therapy and this is what we do, what might be that little nugget that you might pass on to somebody who doesn't know anything about yoga and specifically yoga therapy?
Yeah. I think I would share that it is a practice that connects you back to yourself and to your
Mhm.
own innate healing sources within, connects you back to your intuition, your wisdom, and the teacher or the therapist that you may be working with is just the guide to connect you back to that.
Yeah.
In a nutshell, I think that's what I would say, because that's what I do think that the practice does.
Yeah.
I really remember, hearing some speakers actually in the yoga therapy world mention how
Mhm.
the practice of yoga in these ancient texts is described as moksha shastra, or a science of liberation. Um,
Mhm.
this, right off the bat, it's a spiritual practice.
Yeah.
And yeah, I just kind of keep that at the forefront of my mind. And they'll often say like that the side effects are the health and wellness and the balance.
Right.
But at its
Right. Right.
core, it's a spiritual practice, that's connecting us to our consciousness, to our spirit, to our soul, whatever you want to call it. And you may not say that to someone right off the bat, but I guess in my way of saying it, be like just connecting to yourself, and whatever that
Yeah.
that means to you.
Well, I think it's important to, even just tap into that idea of what somebody, might think if you say spiritual right off the bat, because I think it's important for us to realize that even as yoga therapists, when we say spiritual, right, we're not referring to, you know, God or
Right.
Catholicism or, there's so much more to it. Um, and even though we know that and we go through, those conversations and whatnot with, even our own spiritual conversations, right?
Right, right.
How would you introduce that conversation with somebody who maybe shies away from the idea of spirituality and how that might come up in, say, a practice.
Yeah,
You said it really good before, but just somebody who's like, oh,
yeah, no, I get it. I typically will bring up the koshas and share like pictures or visuals of the koshas, just like as we would learn in school, and
yeah.
describe them. I invite folks, to be like, or ask folks like, are you familiar with this model? And
Mhm.
inform them that this is a model that informs the assessment and practice in yoga therapy, and walk through the model with them, and identify, each of the kosha layers, the physical, the energy, the mental, the witness, intuitive, and then the bliss layer, and mention at that, for Anandamaya, that is a connection to whatever that they feel, connected
Mhm.
to. It could be love, it could be family, a
Yeah.
greater, their own faith, whatever that it is that makes them feel interconnection. And
Yeah.
that those layers are, again, they're interwoven, they're multidimensional, and that there's a ripple effect, that this
Yeah.
practice is going to have a ripple effect on the system of the bodies, and they're usually really interested at, and then they're like, oh, where can I
Yeah.
find out more information about that? um, so like right off the bat, I usually will show an image or a visual about and kind of talk through it with them, and
Yeah.
just and share that this is the assessment tool that we're using to support whole person care, or, look
Hmm.
at the individual as more than just a physical body.
Yeah. That's beautiful. I really loved that word interconnection. Yeah.
Mhm.
Because I think in the long and short of things, I've often said in here that we're a support system, right? We kind of wrap around people because we are going through the different layers of the koshas. And with that being said, when we have all of these support systems put in place, even if one is taken out temporarily, we still have these other pieces. And when the other one comes back in, it's just a stronger support system. So if somebody does have any, you know, thoughts about not necessarily wanting to go into that spiritual piece yet, it's okay because we have these other pieces. And then if and when they're ready, they can bring it in and feel into it and just try it on for size. Because it is
Yeah,
about their healing, it is about what they need for themselves. And that's one of the many benefits of yoga therapy is that you do get to work with somebody and have it, be what they need and what they want and how we can help support them through that process. So,
yeah, definitely. I think what's so beautiful about the practice is that it has that component. And I think that's what makes
mhm,
us different, or, working
mhm,
alongside different aligned professionals, is that there's some languaging for that sheath, or for that kosha, right? For that
yeah,
layer. And it's not dictated by the therapist or by the teacher, but by the participant or by the client, and in their own, and it can be in silence. It can be in
mhm,
their own slowing down, or their own um, connection to feeling and sensing inwardly. And so I
yeah,
think the practice offers a space for that experience to arise.
absolutely.
Mhm.
Well, that was beautiful. So earlier I had asked you before we came on recorded about the low back osteo training that you've done in the past, and you were like, "Oh, we use that too," right?
Yeah.
So, in terms of like workshops, what are some of the workshops that you do, and what are you guys covering? And
Yeah, what's been exciting to work in the integrative medicine services at Memorial Sloan Kettering is that I work alongside other clinicians, fitness instructor, dance therapist, acupuncturist, Tai Chi,
Oh, wow.
meditation, and so we've had opportunities to collaborate where we'll do things, together. And one of our really popular workshops is the osteoporosis. Currently, it's actually being done with the fitness instructor and nutritionist.
Okay.
And that is a very popular workshop. Osteoporosis, osteopenia, common, pain point as we age that we need to be mindful of keeping our bones strong. And specific to the cancer care population, it's important as some of the treatment can impact our bone density. And so I've partnered with, the fitness instructor in the past where we've combined fitness and how yoga can support osteoporosis. And so it's been really collaborative and fun to do it in that way and to share in that way. Currently, I'm partnered with an Ayurvedic physician in the service. Yeah, that's been really exciting. And we've been collaborating and doing workshops. And so sharing the lifestyle practices and kind of the background of Ayurveda combined with yoga practices for each dosha, and being mindful of how we can kind of meet the individual needs in that way. So that's been fun as well. Other ones I've been, there's been breath workshops, breathing, mechanisms of breathing. Outside of yoga, there's dance and yoga combined. There is Tai Chi workshops. There's all kinds of interesting workshops. So, and that's been really fun to collaborate.
And I imagine that, if somebody is struggling, with cancer and the effects of having to treat cancer, inviting them to do workshops that incorporate, a safe, osteo-friendly dance, or breath, right, does bring in a sense of joy.
Yeah, thanks for mentioning that. It's true. There's a community cultivation and a safe space, I think, cultivated through the therapeutic presence of just the environment and of the teachers.
Yeah. Is there any work that you do outside of Memorial Sloan? Do you have your own practice, or can people, work with you one-on-one?
Yeah, definitely. I do work privately with folks one-on-one. I also teach within some university programs. I do some consulting work through a small business program that a friend and I started called Embodied Workplace, where we bring wellness programs into organizations, different organizations, like we've done law firms and the Department of Health here in the city and all kinds of different size organizations. So yeah, it's been fun to be able to take the practices out of, maybe a yoga studio or out of a one-on-one into organizations, because of course this practice can support all of us or anyone who's interested in trying it.
That's awesome. So when you bring this, do you have a model that you work with? And again, you're in New York City, so
yeah. Well, we typically customize it based on what the needs of the organization. So we've done, lunch and learns, where we'll take over an hour and a half or 2 hours, and it'll be a very customized program that includes a little bit of movement, even some reflection, some small group interaction, some sharing. So it'll be it's really fun because we customize it based on what's needed. Sometimes it's, a straight up share on, the benefits of the practices on stress relief and stress reduction. Yeah, so it really depends. We've done like, we'll go in and work, we'll offer one-on-one sessions and like 30-minute
Mhm.
brackets where people can meet with us and do like kind of little yoga therapy sessions or mindfulness sessions for 30 minutes and then go back to their desk. And so
Yeah.
it's been a nice way to bring the practices out into the world and making them accessible and demystifying them as
Yeah.
something that's kind of unattainable or something that you just do in a yoga studio, really being
Hmm.
like, this can be done anywhere and you have access to it.
Right. So, as a fellow yoga therapist, right? I
Yeah.
know, you know. So again, if you were just talking to somebody right off the street, that whole demystifying, and it doesn't have to be in a studio. One of the things that I know that I share with people is, sometimes you'll walk into a studio and you'll see people that are really fit and, you know, in the shape of a pretzel. Um, but that's not necessarily how, you would be doing yoga therapy. So if somebody were to, say that to you, what would you say?
Yeah, that is such a good question because you're right. I think the mainstream view of the practice is physical. And what I
Hmm.
think the beauty of yoga therapy is that we get to talk about all of the other limbs.
Yeah.
And, you know, that the physical is just an entry. And even for my own personal practice, it's like a gateway in, to start sensing where my body is in space and how am I feeling. And then what's so beautiful about it is that it moves more and subtly and subtle as you
Yeah.
get more and more into the practice. I don't know if that answers, but I guess if I were to
Oh,
say that to someone, that essentially it's a mindfulness practice, and
yeah.
that the posture, the pose is just one aspect, and that's not the goal of the practice. Um, or maybe it is for some, and I don't want to speak for others, but that the practice is essentially supporting you through the limbs, from very gross layers to subtle layers towards meditation. And I think I read in a text, I remember reading in one of the texts that the 8 limbs prepare us for
Hmm.
meditation or for the body for meditation, that it's not something we can force, that it's something that we cultivate through the limbs and preparing the body so that meditation can arise in us. And I
Yeah.
don't know if I would say that to somebody just walking down the street, but I think I would, pass along that it is beyond just movement.
Yeah. So, you spoke into the limbs of yoga.
Yeah.
Would you mind sharing the limbs of yoga for somebody who's like limbs, like your limb on your arm, a tree limb? Like,
Yeah, no, great question. I would say that the 8 limbs of 8 limb practice is yamas and niyamas, the moral and ethical guidelines that lead us to live in alignment and kindness with our environment. And there are like 10 commandments, almost to support right living. And then we have the asana, which is the postures, and which actually translates asana means in Sanskrit to sit with ourselves. And so we're getting in these shapes to sit with ourselves in different shapes. And then moving more into the subtle layers, pranayam or breath work is the 4th limb. And then pratyahara, I always think of a turtle, like drawing our senses inward or getting even more subtle. So we've gone from asana to pranayam to pratyahara. Then we've got dharana, which is concentration, dhyana, which is mindfulness, meditation, and then samadhi, which is bliss or flow, oneness. What I think is such a beauty of the practice is that there's all these stages of subtle, like it's not just there's not just one meditation. There's like subtle, more and more subtle aspects of the practice, like a maturation, almost like a maturing meditation.
Yeah. And one of the things that comes up for me is that, you know, there's all these entry points. It's not just the postures, right? Like we can use pranayama, our breath, right? We can use that as an entry point for somebody who maybe, has experienced a lot of trauma within their body and doesn't necessarily, trust their body, using the mindfulness piece, right? Like journaling or mindful walking, right? There's so many different ways that we can come in, which I think lends to the safety of, working in that therapeutic yoga piece, because it's not, here's what we're going to do because you have X, Y, and Z, right? It's not based off of one thing. It's based off of what the person needs. And these are the different entry points. And it doesn't always have to be looking like a pretzel in a
Yeah,
studio.
no, definitely. Thanks for sharing that. Exactly. And those other limbs, like as you mentioned, the breath work and the mindfulness and meditation are more used, I find in therapeutic settings or just in general as yoga therapy sessions, that you're leading more with that. I definitely do in my work at the hospital.
Yeah. One of the things that you said earlier, I had to kind of giggle because I've actually described to my friends the yamas and the niyamas. I'm like, I kind of feel like they're the Ten Commandments, except for I understand them more.
Yeah.
When I first started learning the yamas and the niyamas, what I found with them is they were so much more palatable for me to really understand why, like, say, non-stealing, right? Why non-stealing isn't just taking something, like, in Catholicism or Christian, like when we think of, not stealing, right? It's a physical, like you don't steal something, but within the yamas and the niyamas, we can steal somebody's time, right? Other people can steal from us, and our emotions, right? And so what I love about the yamas and the niyamas is that they kind of go a little bit deeper. And there's definitely that crossover of kind of feels like the Ten Commandments, right? But just being able to explore these different areas within ourselves of what aligns us, like you said, to align ourselves, right? To find that balance within ourselves and really feel rooted, I would say, within our own idea of right living, which does sometimes bring about boundaries, right?
Mhm.
It brings about, understanding that we can connect into what we need to do to live where we need to live in our hearts and in our spirits, right? Versus where somebody else needs to live. So basically, staying on our own side of the road. So there's so much that we can learn from that. And that is, obviously a tool that we use. And I don't know that we've talked about it too much, in other interviews, but, I'm glad that for a few minutes we got to kind of, look at the yamas and the niyamas. My final question, but my almost final question to you is, where can people find you?
People can find me on at yogawithtina.com. You can find info there and you can connect with me through the website. And yeah, or LinkedIn. I'm on LinkedIn as well. I'm not as I guess active on some of the other platforms. So the main area would be to check out my website.
Yeah. And if somebody were to be looking at you going, oh, I'd love to talk to her. What are some of the areas that you feel are your strengths in terms of, working with people? Your focuses.
My focuses, yeah. I'm guessing cancer care and slow flow. Even before I went through yoga therapy training, I always would attract, or I guess I would share really slow flow, somatic type of, classes.
Mhm.
And so I felt like they were always more therapeutic in a sense.
Mhm.
Um, and so yeah, I think I worked with so many different kinds of conditions, but sleep, I think is a good pain, chronic pain, cancer care, anxiety, and stress. Um,
Yeah.
some of the main ones that come to mind, just overall stress reduction.
Okay. You just brought up one that I actually hear a lot about um, in sleep. And when I'm referring to, sleep hygiene, like how do you
Yeah.
know, how would you support somebody? Because there are a lot of people, especially, in my world, it seems like there's a lot of people who struggle with insomnia. What is like one little tool that you might use, in yoga therapy, to help them with their sleep hygiene?
For the yoga therapy tool, I typically use restorative postures,
Hmm.
and also from an Ayurvedic lens, Abhyanga, which is self massage with warm oil to
Hmm.
almost prepare the mind and body to kind of slow down and also support kind of nourishment towards yourself. I
Hmm.
know there's so much talk now about sleep hygiene, especially because in modern
Yeah.
times we're so bombarded with tech. And so also talking about the environment, creating an environment for sleep. Um, and also sharing, like, are you getting enough light in the morning? Because we know that that early morning light actually impacts us and supports our sleep and our rhythms, our circadian rhythms. So we get a
Yeah.
good night's sleep later. I know it's more complicated than that, for insomnia, but those are some of the tips that come to mind
Well,
that
I
I
think that
shared.
was perfect. No, that was absolutely perfect because I think that it is important to understand that it is again, there's different avenues to help support,
Mhm.
good sleep hygiene because I do think that just judging by the amount of people that I'm hearing, say, I have insomnia, I'm not sleeping well, and we need sleep. We need sleep to heal. We need that space to allow our bodies to rest. So thank you for sharing.
Yeah, of course. Thanks for
Pick your
asking.
brain. And now the final question. Is there anything else that you would like to share with us?
I just wanted to say thanks so much, Marie, for having me. I really think it's exciting that you are lifting visibility of this work. Um, I guess to everyone out there, if you're curious about yoga therapy, there are, folks around the world that are sharing this, and
Mhm.
you can find certified yoga therapists through I-YT's website, which is a database that gathers C-IAYT. It has a listing of C-IAYTs, and yeah, to try it. And you can always find your angle in, if it's not the
Yeah.
physical, it's the breath or mindfulness. So yeah.
Mhm. Thank you. Thank you for that. Tina, thank you so much for joining me today. I really am just so grateful on many levels to have you here. So thank you. Thank you. And
Thank
hopefully
you.
I can have you on again.
Yeah, I really enjoyed it. Thank you so much, Marie.
Thank you.
Thank you for joining us today. If you would like to support this content, hit the like button, subscribe, or leave a comment. Thank you so much for joining us. Have a fabulous day.